Well, I just want to thank everyone for joining us this morning. Thank you for coming out for this mid-AEP update. We're getting a lot of questions from agents, and we're having a lot of communication with our carriers at this point of the year. And we wanted to bring some of those questions and some of those tips to each of you who are joining either live or viewing this later on a recorded platform. And with us today, we have UHC and we have Tabitha Mullen.
Hello, thanks for having me.
Thanks for joining us, Tabitha. Great to see you again. Tabitha is going to go over some of the high points of United Healthcare with us. And then we're going to do after that, just kind of a little interview style, ask a few questions that we're getting from agents in the field. And hopefully we can help give you some great tips on why to choose UHC and better practices to help grow your business and your productivity within the Medicare Advantage space. So with that, Tabitha, I'm going to turn it over to you and let you get into your presentation.
So I don't want to take up a bunch of your time today going over all of the details, all the nitty gritty with the Medicare Advantage plans line by line and the dual special needs plans. So if you are in need of the product portfolio sheets for Michigan, we've got two Medicare Advantage PDP plans, MAPD plans in the Detroit market. We also have two new ones in the East Michigan market, which is just above Oakland County. That's going to be the Genessee, Saginaw, Tuscola, Bay County areas. There's two specific separate MAPDs in that area. There are two MAPDs on the west side of the state, and then there is one in the UP northern area. We also have an MA only plan, which is offered the same MA plan offered in all of those counties. And then we have two dual special needs plans. We have an HMO and a PPO. And for 2023, we also have a partial dual. So if you're someone who dabbles even a little bit in the dual sphere and you've got those people who are on spend downs, don't have full Medicaid and didn't qualify for a dual special needs plan, they can actually get on a partial. So if you need information or details or the shopping sheets for any of those, please email me and I will forward that out to you. If there's anything that you hear me talk about or you see on here that you need a copy of, also feel free to reach out to me. And I'm going to be sending all of this to Jason and to Cass as well. So you can also reach out to them. And I know they've got all the stuff at their fingertips too, and they're more than happy to help. All right. So I just want to go over a few updates that might be interesting for all of you. You can complete that HA on Sunfire, Connecture, and My Medicare Bot starting now. So as before, you could only get that $75 for completing that health assessment directly in Lean. You can now do it in your own platform, which is really, really great. That's $75 on all products. You now have more access to doing a lot of stuff for your clients, which I know is a blessing and a curse sometimes. When you have the ability to do it, they kind of lean on you for it. But we just wanted you to be able to have access, as I know that's part of the selling point for a lot of you agents, is not necessarily being a customer service representative, but being able to assist your clients when they request something. And I think it helps with your credibility. Right now, you can go into Jarvis, into Lean. You can help them order a new ID card. You can change their PCP in Jarvis if you need to. And there's also new updated certification check in Lean. So when you go into Lean and you're ready to fill out an application for a client, it will stop you or alert you if you are not certified to sell that, so you don't get a CTM and lose commissions. You're able to go in there and get that certification first. We do have increased PhD staffing this year. We have new agent success program, priority queue routing for the chat. It was just priority routing when you called into PhD. We've added that to the chat as well. All of the materials for sales are all up in either the sales material portal or the toolkit. So just to differentiate between that, us United Healthcare market managers in the field, it will be changing soon, but for right now, we actually don't have access to the corporate office that's locally, which means we don't have access to keep bulk materials. So it's really important that you as an agent or your small agency order those materials that you need, because we don't have like a stockpile where we can kind of take and have you come over and just pick them up. Enrollment guides, scopes of appointment, evidence of coverage, those materials are going to be in the sales material portal in Jarvis. Anything that's like marketing is going to be in the toolkit.
Hey,
and again, if you have, yeah, go ahead.
Sorry, real quick, just insert. So we do have a nice little stock here at the office. So for local agents, if you do need some United Healthcare materials, we have those. Just give us a call ahead of time. Our team will pull it aside and you can pick those up at our office as well.
That's awesome. That's such a huge help. We're looking at getting some local M&R real estate for UHC. So stay tuned for that. Okay. And then quick update for dental. So for 2023, starting January 1st, all the dental, the embedded dental aspects of the Medicare Advantage and dual special needs plans across the country. So So Medicare Advantage, United Healthcare Dual Special Needs plans, any plans that have an embedded dental aspect into the plan are all one level now, one enhanced dental level. And that's going to include everything that's CMS allowable. So including implants, including dentures. It starts at $1. There is no cost share. There's no pre-authorization. So if your client has $2,000 of coverage, it starts on day one. They don't have to be reimbursed. They don't need pre-authorizations. If they're getting implants, we'll cover up to $2,000 of that, whatever their coverage limit is. After that, they're going to have to pay out of pocket. But before that, before they reach that limit for that dental coverage, they're not paying for anything that's CMS approved. What is CMS not approved? Cosmetic, right? So no teeth whitening and veneers. Everything else that would be CMS approved is going to be covered. It's all one dental level. There you go. Orthodontics, cosmetic services. The open plan twos across the state have a flex card. I just wanted to remind you that it's just the open plan two. It's the ones that are like $28 a month versus the $0. There is a flex card. For instance, the one in the MAPD open plan two in Detroit has that flex benefit. I believe it's $250. It can only be used towards dental, vision, hearing. That it's a separate card from everything else, and it's only for dental, vision, and hearing. I believe it's a Visa card. It is prepaid, and they get it on day one. So they could use that $250 towards dental, vision, hearing, a mixture of those in January, and that would be fine. They can use it immediately. So just wanted to give you an update on that. And then the most important, so you'll see here, there's like a little flyer. It's got some red marks. It's not fully completed just yet. We are working on this, and I'm hoping that even possibly by the end of the week, we'll be able to send this out to you. We've heard all of your comments and your requests. We understand how important it is for you and for your clients to understand the open PPO nature. So I just want to talk about that for a second. This is just a reminder. All of our Medicare Advantage plans with United Healthcare, the MAPDs and the MA only are all open PPOs. They are true open PPOs. And so is our D-SNP PPO. It's a completely open network PPO, which means, as the wording in the flyer says, and we'll get that out to you when it's officially approved. I just wanted to give you a sneak peek that they can see any provider who accepts Medicare whenever they need their care. It doesn't matter if it's in network or out of network. It doesn't matter if it's for their primary or their specialist. It doesn't matter. They're still going to be covered. There's no extra charge for them going to see a provider out of network. That being said, the provider does have to be friendly with billing us out of network. So the provider has to agree basically just to send us the bill. Now, sometimes your clients, because the open PPO nature on the Medicare side is pretty new in Michigan, there are some bumps where provider offices or the new people who handle billing just don't understand that concept of how do I bill out of network. We do have a quick reference guide I'll show you on the next page. Feel free to give them this, give your client this, so that they're assured, yes, you can still go to your primary even though they're not in network. It's not going to cost you anything extra. We'll give the quick reference guide to the provider as well so they know how to bill us as out of network. And if you still think they need a little bit of extra education, we also have a provider escalation form. You can fill that out, send it to me. We will have a provider advocate reach out and educate the provider on how to bill us out of network for your client so they can continue to go there. They do not need to be in network. For instance, we are not in network with Henry Ford, and we have a good portion of our current MAPD members from the last year and a half that all go see Henry Ford Hospital and Henry Ford providers without a problem. If you do have a problem, escalate it. If you're doing an enrollment, whether it's in Lean or wherever you're filling out that application in your own profile, make sure you're using that non-par prov code. I've listed it here. It's like a little picture and it tells you how to put that code in. It has to be that specific letter and wording, but you just need to put in non-par prov. And then you need to put the provider's name in that like number section. So if you need a copy of that, again, I will send this out so that everyone has it, but you can still put their primary's name on the application. You don't want to put a bunch of zeros and just choose a random provider. Put their primary in there. Just make sure you use the non-par prov code and you'll be good. And again, this is just a quick reference for you of what these look like. I'll send these documents out. I know Cass already has them as well, but this is a quick reference guide that's really nice to either email, fax over, or give it to your client to give to their provider that explains to the provider how to bill us as out of network. And this is the copy of the escalation form. So you would just fill that out, send it to me. If you need to have provider education, reach out to the provider and educate them on how to bill us out of network. Again, it's a true open PPO. If their provider is not showing up in network and rally, it doesn't matter. As long as you're putting them on a PPO, it's a true open PPO. Just a quick reminder, although we did not retain our 5-star for next year, I believe we're 4.5, you can still use that 5-star SEP right now until the end of this month. So if you have someone you're putting on an open plan 1 or an open plan 2, and they don't want to wait until January, they actually want to get on there a little bit earlier, you can give them a 12/1 effective and use the 5-star SEP, so long as they haven't used their SEP yet this year. So that is a big help. I have a couple agencies that are like, can we still use the 5-star SEP? This guy is messed up on his current plan and really needs to get on there quickly. His medication isn't being covered on his other plan. Yes, you can use the 5-star SEP until the end of this month, only for 12/1 effectives. Once we hit December, it's obviously just AEP and you can't use the 5-star SEP. They can be on any plan and go to a 5-star plan. So they can be on a PDP and go to a 5-star plan. They can be on a current 5-star plan and move to another 5-star plan, as long as they haven't used the 5-star SEP. And then just a quick reminder, starting 1/1, every single one of our Medicare Advantage and dual special needs plan members across the nation are getting an upgraded member ID card, and it's going to be the U card. So the front of that U card is going to have all of their member ID information in it, like it normally would for their prescriptions, RX, their provider name, their group information, all of that good stuff. But on the back, it's going to have a barcode. That barcode is going to be used for their Renew Active, for them to use their OTC benefit in person at retailers. If they're a D-SNP member, that barcode is going to be used to purchase their groceries or pay for their utilities. So the back of that is going to be everything, and also to check into their gym with the Renew Active fitness membership. So that's just an update. Just keep in mind, they'll get a new U card. All of them will. Just wanted to give you a little look at the rewards. They will get rewards, and they'll get information in their welcome kit about how they can earn rewards. One thing I wanted to highlight is that when you do the health assessment for your client, you get that $75. They actually immediately get, I believe it's $10 in Renew Active dollars. So dollars on their Renew Active benefit card for completing that health assessment. So that might be a nice little selling point for you to get them to hurry up and help you fill out that health assessment, because not only are you getting paid, but they're also getting $10 added to the back of that U card. I think that was all the points I wanted to make sure I hit. Did you have anything else for me, Jason?
Yeah, no, that's great. And I think, what we can do is kind of go into a few of the questions that we had talked about and,
Sure.
just kind of discuss those now that you've gone through some of those core elements. So one of the things we're trying to do here, and this goes back to some of the confusion questions we're getting, is, we all get to about this time of year, we've all gone through multiple certifications. We've got, a lot going on within the business itself. A couple questions. One would be, what would you narrow down and say, hey, United Healthcare, both existing as well as maybe expansion counties, here's our product. Give us some highlights that would tell the agent, hey, this is where we shine. This is when you would pull our products out over someone else.
Yeah, I think I kind of covered that already too, which is, in my opinion, what probably differentiates us the most is going to be the open PPO network. They can go anywhere. So especially when you have those clients that are maybe used to a Med Sup and they really want a Medicare Advantage plan, but they want the freedom of being able to go to any provider they want without, having a pre-authorization or referral needed, or even those clients who go out of state a lot. The Medicare Advantage plans are open PPO, and they get access to our national network. So if you've got people here who want to have a Medicare Advantage plan, they're snowbirds, they go to Florida for the winter months, they have access to our national network when they're in Florida. They can see any of our in-network providers in whatever state they go to. So the open PPO is really nice. And then probably the dental too. A lot of carriers in the state have really great looking at first glance dental benefits, but we've really done a good job of beefing this dental benefit up for 2023. So it starts at $1. You don't need pre-authorizations. There's no reimbursement. There's no buy-up. It covers everything that CMS allows us to cover on day one. So if on January 1st, your client walked into their dental office and needed partial dentures and they had $2,000 of coverage, $2,000 of that is paid for, no questions asked. So I think those are the two biggest, I would say, differentiators, and having the PPO on the D-SNP too. So for those that sell D-SNP, we used to have a problem in the Ann Arbor, Ypsilanti area where we're enrolling D-SNP members. Half of the people want to go to U of M hospital, the other half go to St. Joe because they're in Ypsilanti. Ypsilanti. And nobody's traveling, 20 minutes away just to go to a doctor when one is right in their backyard. And so that PPO D-SNP has really been, that differentiator, that easy button is what we like to call it. Doctor's not in network, no problem, easy button PPO.
Awesome. No, those are great points. Speaking of dental, which obviously we know is a huge component to Medicare Advantage plans this year, great product. One question we had pop up is, what is the network for the embedded dental?
So we actually own our own network. We own our own United Healthcare Dental Network, and we recommend to all of our members that they stay in network for dental. However, the dental is also open PPO. So they can go out of network. They can go to any dentist they want, so long as that dentist is going to bill us, with the caveat of, I highly recommend you have the conversation with your client and tell the client to have the conversation with the provider that, hey, I know this is an open PPO and I can go to you and you guys can bill UHC out of network, but CMS, we're only going to cover the CMS max allowable rate for services. So that means if for a filling, the max CMS allowable rate is $375, but your dentist, Dr. Smith, wants to charge you $400 because he's like, oh, it's an open PPO, I'm just going to charge what I want. That client's going to get a balance bill for $25. So it's really important to have that conversation with the dentist ahead of time that, hey, I want to stay with you, Dr. Smith. You're out of network. I'd like to still stay here, but if you're going to charge me over the CMS allowable rates for services, I need to know ahead of time because I don't want to have a balance bill.
Okay.
So that's the only caveat there, but we own our own network and there is no possibility for balance billing when you stay in network.
Awesome. Okay. But as long as the dentist is willing to bill the United Healthcare, then we're good.
Yep.
Okay. Awesome. No, great point. Makes that feature obviously that much more, realistic to these enrollees.
Yes.
So, awesome. Now, changing that question a little bit, what are you hearing? And I've got a little bit of, obviously feedback from the field as well, but those are some of the carrier perspective highlights. Here's where we shine. When you talk to agents in the field, they're selling United Healthcare, preferring United Healthcare. What are some of the reasons why, they pull out United Healthcare over another carrier?
I think one, the ease of the network and the product itself. The product is pretty, it's nice, and there's not a bunch of catches. There's not a bunch of like asterisks on the bottom and small print. We're like, oh, nope, you can't use it for that. Oh, no, you can't use it for that. So the product is really great. And it's a Fortune 5 company, which means it's really large, which means it does a couple things really well. I'll say our customer service is really great. For most things, I'm telling agents all the time when they're emailing me and saying, hey, client sent me this email or client wants this. I'm like, why are you dealing with that? You're not a customer service representative.
Yeah.
We have those. We have lots of those. We spend millions a year on those and they're great. And they're going to get a response immediately. So for a lot of things, I tell agents, hey, refer them to customer service or member services because member services are required to help them with this and they will. On the D-SNP side, we have navigators and the navigator program is great because if I'm on the plan and my navigator is Terry's my navigator all year long. So I can call the number on the back of my card and say, hey, can you, transfer me over to my navigator, Terry? And I'm speaking to Terry all year long, which is really nice. And they help them holistically with everything, whether it's from, oh, there's been a lapse in my Medicaid or my LIS. I need to find a new provider. I need help finding, cheaper medications or something like that. Anything would go towards their member services or their navigator. So the open PPO network, the ease, the plan looks really good. We are really happy about the product. I keep talking about the D-SNP, but we've made some really big expansions on the D-SNP side, which is why I'm happy because the Navigator program is great. I think we offer the most in the state for the OTC healthy food, groceries, and utilities credit per month. And again, there's no asterisks there. So if someone's on the D-SNP plan, they get that OTC healthy food, groceries, and utilities card benefit. There's no extra step to qualify. They immediately get it. Awesome. And it's a lot of money. On one of the plans, on the HMO, it's $180. On the PPO, it's $155, and that's every single month. $180 that you can spend on groceries or utilities is awesome. So those are some good selling points for sure.
Yeah, absolutely. No, those are great points. And I would say to add to that, the agents we talk to, they obviously love the brand recognition.
Nationwide.
National carrier, you've got your Medicare supplement component, which, tied to AERP has obviously been a huge, opportunity for people to have that brand, the power behind that, as well as then, eventually maybe see the value in a Medicare Advantage or vice versa. It's great that they can have those core solutions amongst the same carrier.
Yeah, and that national network is key because especially in Michigan, because so many of the residents here, once they turn 65, they've got multiple homes, somewhere here and somewhere warmer, which gives them a lot of flexibility because if they're staying a few months out of the year somewhere else, they need to be able to use that Medicare Advantage plan in another state, not just for emergency purposes.
Yeah, absolutely. No, that's what we hear a lot. And obviously you guys do a great job contributing to the success of the agents. You've got your, the Mira program. We have some agents working some of those leads.
Yeah.
You guys are out there in the community. So a variety of things that we know agents are benefiting from that you guys do a great job at.
Thank you.
No, those are all good points. So what are you hearing? Obviously we're hearing from agents that their AEP started a little bit slower. We're hearing from carriers that their AEP is start a little bit slower. What are you hearing and what are you guys doing to help these agents, have a better, more successful AEP and beyond?
Yeah, we're hearing the same. We're seeing the same here. So I'm glad actually to hear that you guys are seeing it too. It's
Yeah.
not just us. And I think what I think it really boils down to is that really big CMS ruling about call recordings. And it made a lot of agents at the very last minute have to go, okay, we actually have to do this. And I'm sure just out of human nature, there's been a decent aspect of how do I avoid doing this? And how do you avoid the call recording? Meeting in person.
Yeah.
Well, what are the ramifications of doing all your appointments in person? It takes longer. For the last couple of years, we've been able to all just get on a quick Zoom or get on a call, do an enrollment quick over the phone. But I think a lot of agents were either a little nervous or they weren't yet prepared once October 15th hit to start recording. So what they really decided is let's just set in-person appointments, which just take longer. So there's been a bit of a slower start, but I've seen even recently in the last couple of weeks with agents getting a lot more comfortable with the recording aspect, which has really helped kind of pick that speed back up. But we're trying our best to help with the in-person appointments as much as possible. We already offer for our EDC direct agents or our captive agents, some type of solution for the recording. Most of, FMOs and NMAs have also either offered or at least given them options or assisted with let me help you find a solution that's good for you. So I think there's been a lot of momentum there. But what we've been trying to do is just help, especially where there's brick and mortar offices, push foot traffic. We've spent a lot on advertising in newspapers, like newsletters, social media, just trying to advertise resource center events or walk-in events to offices, really just to emphasize people coming into you while you're in the office, which has really, really been great. And that's been helpful. And we're seeing a lot of the fruits of that labor in the last couple of weeks.
Okay, awesome. Yeah, don't be too nervous. Both you and the agents, we're hearing that from everybody that it's been a slow AEP. And, I think it's going to pick back up. I think some conversations, even that, maybe it's due to the election and all that stuff that's now behind us.
Less distractions. That's what we were just saying this morning. Hey, elections times are over, regardless of the results. One less distraction. Yeah.
Yeah, absolutely. No, you're right. So just to kind of wrap up, any other tips you have for agents? Maybe they're getting their Medicare business started. Maybe they're, trying to, put forth, I guess, some better practices to really grow their Medicare sales. Any tips you can offer from top agents that you work with?
Yeah, a couple things stand out to me. And I think, in my opinion, for someone just starting out that's really trying to gain momentum, both points for me really boil down to engagement and marketing and advertising yourself where you can. The top agents that we have make it a priority and are really good about engaging, being a part of their local groups, whether it's like social media or chamber of commerce, attending events, getting your name out there, asking about events, doing things in the community. That's really helpful. One. And two, going the extra mile with your clients, because referrals is the best way for you to grow your business. If you do someone right, you do grandma right, grandma's going to tell all of her friends and their husbands and their spouses, when they go to play bingo, they're telling other people about what they have. You know what I mean? mean? So,
Yeah.
and we have the toolkit, which is really nice. I always tell agents, like, if you're trying to grow your business, like show up to everything where you can be your business, show off your business, even things small, like, we're getting closer to Thanksgiving, right? Small business Saturday, all of these agents, they own their own small business. You're 1099, you are your own small business. Talk to communities about setting up a table where you can sit there and have a table. Sometimes these tables are free. Sometimes they're like, hey, if you can bring hot chocolate or have something to offer that you're giving out, hand warmers during downtown. For instance, I'm just thinking in my head, downtown Royal Oak is having like a big downtown shopping day for Shop Local Small Business Saturday, right? And they invited us, and we have an agent going that's going to set up a table and is going to pour some hot chocolate and give out their business cards and their information. Just finding ways where you can be in the community and being seen. And when you do enrollments with clients, making sure you're following up with them. Like our toolkit, we've got cards, like greeting cards, thank you cards, writing cards. I have a couple ICA agents that were brand new. This is their first AEP. They're already killing it. And every time they're doing an enrollment, they're filling out a card, thanking someone, like writing like almost an actual letter, like a novel in these cards. The cards they're getting for free on the toolkit, putting their business cards in there, putting in a brochure for them to give to their friends and sending out. And it's working. So getting noticed and doing right by your clients and going the extra mile with like thank you and appreciation really helps with referrals too.
Yeah, no, good points. And, just to add to that, you mentioned something, and you talked about your clients. Well, you have to treat them that way. When I talk to agents who have no engagement with their clients, so to speak, that's not really a client. If you haven't talked to that person in 2-3 years, they were just a customer at some point. They don't even view you as your agent. So unless you go into this prepared to either, work with them on other needs, other solutions, be of greater value, advise them, communicate with them as frequently as possible, whether it's through like a Facebook group or through like a newsletter, or you do an annual, semi-annual review. Agents that do that, they're viewed by these individuals as their agent, as their advisor, and they're going to give you those referrals. They're going to come to you with other needs. If you've literally enrolled them in their home virtually or at a Walmart and you never talk to them again, that's, they don't view you in that way. You're never going to get a referral from that source.
Yeah. Retention and referrals come down to one thing. Are you this client's sales agent, insurance sales agent, or are you their advisor, their navigator? You know what I mean? You have to be a resource to your clients, and they do have to remember you and know that they can come to you for questions, and you'll at least help them navigate or give them a resource or show them where to go. Otherwise, you're just a sales rep and they'll find another. I get emails all the time, so-and-so, called in and someone else enrolled them. I need to change AOR. We get a lot of those. And it's like, your clients should know you, and they should know to call you. They should know to call Jason before I make any changes with my insurance, not because you're not going to get the credit or the commissions, but because that you're the person that they trust to help them and navigate for them. So absolutely.
Totally agree. Set that tone early, because once they know that you're involved with them, they're going to re-engage with you too. Because I have that other where an agent goes, okay, I'm going to try to put this into my practice. And those clients that they try and go back to 2-3 years earlier are like, well, who are you and why are you calling me? And I'm not interested. So start that early and develop that relationship.
Absolutely.
Well, like you said, you guys have great tools and resources on your website. Free. Yeah, which is better.
Well, I always tell people, I'm like, the toolkit literally, and some people get a little bit confused, but I always tell them, hey, it doesn't, for certain things, like say the thank you cards and the greeting cards and those things that you can send out with the envelopes that are really nice throughout the year, go into the toolkit, filter by dual special needs, because they're all free. And what's the difference between them? It's not like, thank you for choosing a dual special needs plan. It'll just say thank you, or it'll be a nice card that's completely blank, but on the back of the card in a small print, it'll say United Healthcare Dual Complete. That means nothing to the client, right? They're looking at the card and they're looking at, what you wrote to them. They don't care, if it says Medicare Advantage or dual or community plan, that's not something that's going to trigger them to have questions. So use the free materials that you can, get those for free, and then you're only paying for postage. And I always say too, if you come across something, especially when it concerns me, I think I manage the account for IAD. So most of your agents probably fall under me. If you've got an event or something where there's a vendor fee that needs to be paid, or you're looking for some help on some postage for some retention cards or something like that, reach out to me. It doesn't hurt to ask me. If I have the budget budget and I can do it, I probably will. Sometimes I have to get a second layer of approval for certain things and it depends on the cost, but I'm always open to cost sharing if it's going to help you with sales and retention. So always, it doesn't hurt to ask, hey, Tab, there's a veterans event coming up and the fee is $150. Would UHC be interested in, covering that for me so I can go and sell? 100%. So, and especially, maybe not even right now during AEP, but there are still stuff going on, before the end of AEP. So, keep us in mind, let us know. But even for next year and beyond, we have an entire dual special needs plan sponsorship budget where we spend, Jason, $100,000 a year just on dual special needs plan sponsorships. And a lot of times we are really good at finding sponsorships where an agent can go in there. And we might have sponsored it with a D-SNP focus, but there's a bunch of MAs, there's a bunch of med subs. When you think about things like Parkinson's walk, dual special needs plan sponsored the Parkinson's walk, but Parkinson's isn't limited to people on Medicaid. There's a lot of attendees. So an agent goes there and you're seeing all different types of groups of people, whether it's Medicare or IFP, Medicare Advantage, D-SNP, med sup. So, when you have things that come up, come to us. It doesn't hurt to ask.
Absolutely. No, great point. And, same with our team, being an FMO with United Healthcare, they provide us additional benefits, budgets for different marketing purposes, lead generation. So both Tabitha, come to us, let us know how we can participate, because sometimes we don't know what you're trying to do or what dollars you might need to spend. To be honest with you, we're willing to contribute and co-op and support some of those efforts. We just need to see the effort. If an agent's willing to go do some of the legwork, introduce themselves to those events, those communities, we'll be more than happy to contribute. We just need somebody who's willing to actually go put in that legwork and then show up to those events. Obviously, the opportunity is there for you to convert those. So yeah, all great points, great reminders. So I appreciate all of that. So I think with time, we'll kind of wrap up here. Any last comments you'd like to make before we wrap up?
Just to drill home, because I swear I get a few emails and texts about it every single day. Just to drive home, anytime you see PPO next to one of our plans, it's an open PPO. I get a lot of comments and texts and emails like, hey, Tabitha, I want to sign this person up, but one of her doctors are not in network. So cool, sign them up. It doesn't matter. They can go anywhere they want, as long as the provider will bill us, and we've had very few instances where at the end of the day, the provider outright still refused to bill us. We're talking about thousands of members, and we've probably had a handful of those, maybe 3 instances total that I know of throughout an entire year where a provider still refused to bill us as out of network. I will say, I know Dedicated and Oak Street are not friendly with the PPO. Those are the only instances that I can think of. So the open PPO is really truly an open PPO. Your client can go anywhere as long as the provider will bill us. They have access to the national network. Dental starts on $1. So, get people on the plan. If they need to get on there early, use that 5-star SCP and get them on for 12/1.
Good tip. No, that's a great reminder. Well, thank you so much, Tabitha. I appreciate you joining us today, and thank all of you for joining us either live or those of you who might be viewing this in the future in a recorded platform. Again, if you have some interest in any of the marketing dollars we just talked about, or you're not currently associated with United Healthcare and the Medicare products, please let us know at Insurance Advisors Direct. We'll make sure we get you set up, certified, ready to sell. And anything else you need for year-round selling, marketing, please talk with Tabitha, come to us. We have a marketing team here dedicated to support you in those year-round efforts. So I want to thank everyone for their partnership and wish everyone a great rest of your AEP.
Happy AEP. Thanks for having me.
Thanks, Tabitha. Bye now.